What's up, fam? It's your boy called Emadema, and this is the Oral Health Bar Talk. And today's topic is oral piercings and their effect on your mouth. So, as always, I will be reviewing a few articles, and the first of those articles is an article by the American Dental Association, part of their mouth healthy page. So, a few things they have here is the effects of the oral piercings on your mouth. So, first of all, it says infection, pain, and swelling. So basically, your mouth is a moist environment home to huge amounts of breeding bacteria. As we talked about in the previous video about the bacteria in your mouth and how it affects infections with tattoos, same goes for your piercings. So basically it says in an ideal place for infection, as I just said. Infection can quickly become life-threatening if not treated promptly. It's also possible for a piercing to cause your tongue to swell, potentially blocking your airways. So basically what they're trying to give a picture of is that piercings can lead to infections, and infections have various degrees of prognosis. It can become an inflamed tongue, block your airways, and you choke because of a piercing. Okay, it's not that deep. So the second thing they talk about here is damage to gums, teeth, and fillings. A common habit of biting or playing with piercing can injure your gums and lead to cracked, scratched, or sensitive teeth. Piercings can also damage fillings. Basically what they're saying is people with piercings in their mouth usually play with the piercing. I don't know why, but biting on the piercing, playing with it can actually cause cracking of your teeth. As you would imagine, any hard object would have that effect on your hard tissue, which is your teeth, and can damage the fillings in your mouth. So the second thing they say here is hypersensitivity to metals. Allergic reactions at the pierced site are also possible. So basically there's certain metals, so this probably happens more with restorations. In olden days they had these amalgam restorations. I don't know if they're still done, but amalgam restorations cause a hypersensitive allergic reaction in certain people. So that leads towards getting ulcers and all sorts of things, infections in your mouth. So some people might be allergic to the metals that found in piercings. So that's why it's important for you to always consult with your dental hygienist or your dentist when it comes to things like this. So the next thing they talk about is nerve damage. After piercing, you may experience a numb tongue that is caused by nerve damage that is usually temporary but can sometimes be permanent. The injured nerve may affect your sense of taste or how you move your mouth, damage your tongue's blood vessels, can cause serious blood loss. So basically guys, your piercing guy, your body mod dude, he's not a dentist, he's not a dental hygienist, he's not a doctor, unless he is. Then you can trust that dude. Dude's solid. But that's why it's important for you to consult with your dentist, your medical practitioner, your dental hygienist, because they know their anatomy, they studied the anatomy, and they failed it over and over again, but they got it right in the end. And yeah, they know more about the tongue's anatomy and where the nerves are found and all of that. So when you have those nerves in certain places and blood vessels in certain places, it leads towards a nerve damage and blood vessel damage. So sometimes it's temporary, sometimes it's permanent. And when it's permanent, yeah, you won't feel your tongue, and yeah, that must be good for your relationships. I'm joking, but yeah, nerve damage is caused. So if what are piercing guys known as? I keep saying tattoo artists in my head, but yeah, comment below what are piercing guys called? I don't know, what are we called? But yeah, those piercing people who pierce your tongue or oral tissues. Yeah, just make sure they know what they're doing. Consult with your dentist, he'll tell you what to do, your dental hygienist actually, or your dentist. So there's also excessive drooling. The tongue piercing can increase saliva production. Okay, so basically what they're trying to say is that your your tongue piercing can cause excessive saliva production because there's certain, what can I call them, ducts, or what's the word called, salivary glands that are underneath the tongue. So it depends on where the piercing is, and it could lead to piercing into that salivary gland and salivary duct, which could increase the production of saliva in your mouth, which increases the drooling and whatnot. So the last thing we have is dental appointment difficulties. The jewelry can get in the way of dental care by blocking x-rays. So we see this most of the time when people come for x-rays for their dental appointments. They have to take off any jewelry or anything. So what happens is when you have these oral piercings and whatnot, it comes off as an artifact. It's called an artifact on your x-ray. And when that is shown on your x-ray, these artifacts can block important things like lesions that cannot be seen underneath that certain piercing. Okay, so what it says here, if you already have piercings, contact your dentist or physician immediately if you have signs of infection, swelling, pain, fever, chills, shaking, or red streaked appearance around the site of the piercing. Keep the piercing site clean and free of any matter that may collect on the jewelry by using a mouth rinse after every meal. To avoid clicking the jewelry against your teeth and avoid stress on the piercing, be gentle and aware of the jewelry's movement when talking and chewing. Check the tightness of your jewelry periodically with clean hands. Wash your hands before you check the site because you might get an infection and we don't want that. Check the tightness of your jewelry periodically. I've already said that, sorry. When taking part in sports, remove the jewelry and protect your mouth with a mouth guard. See your dentist regularly and remember, brush twice and floss daily at least once. Okay, so that's the first article we've got from the ADA. So my second one is always going to be from Colgate because Colgate's hip, guys. Try Colgate, always. I'm joking. I'm not allowed to recommend any brands for you. But Colgate's tight, guys. So here we go. What are the different risks involved in oral piercings? They say, first of all, infection. Our mouths are containing millions of bacteria which can lead to infection after an oral piercing. Handling jewelry once it has been placed in the mouth also increases the chance of getting infection. So basically what they're saying is what was said in the ADA website about infections, the mouth, the bacteria. So guys, the mouth is very dirty. The bacteria you have in your mouth it would surprise you. So when you kiss your girlfriend or boyfriend next time, just think about that. And of course, as I was saying, with what the ADA was talking about when preventing infections, you wash your hands before you touch your piercing in the mouth. Okay? So prolonged bleeding, if a blood vessel is punctured by the needle during your piercing, the result can be difficult to control bleeding and serious blood loss. We've gone through that. Pain and swelling. Pain and swelling are common symptoms of an oral piercings. In extreme cases, a severely swollen tongue can actually close off the airway and restrict breathing. So it's the same thing. Your tongue grows because of the infection and swollen tongue, and you might choke or not breathe properly or whatever happens when your airways are restricted. You might die from the piercing. Basically. Wow, this is so depressing. Okay, so a chipped or cracked tooth, contact with the oral jewelry can fracture teeth. We've already gone through that. Injury to the gums. Not only can metal jewelry injure soft tissue gum, it can cause the gums to recede. In addition, looking unattractive, receded gums leave your tooth root more vulnerable to decay and periodontal disease. So your piercings can cause a kind of recession of your gums because it might rub on your gums or trauma or mechanical wear on your gums. Mechanical wear on your gums can recede your gums and your roots are exposed, and when you smile you look like a freaking psychopath. Okay, it's not that deep again, sorry guys. But yeah, you need to think about that. So, interference with normal oral function, jewelry in the mouth can cause excessive salivary flow, impede your ability to pronounce words correctly, and cause problems with chewing and swallowing. So, what Colgate is coming in with the angle of all that unattractiveness and all of that. So, they're trying to tell you what oral piercings can do for your lung ducts. So, blood-borne diseases, oral piercings have been identified at the National Institution of Health as a possible factor for transmitting hepatitis B, C, D, and G, ZAB2. No, I'm joking. But yeah, guys, it's important to know that blood-borne diseases can be transmitted through oral piercings. And last of all, they have endocarditis. Oral piercing carries a risk of endocarditis and inflammation of your heart valves. The wound created during oral piercings provides an opportunity for the bacteria to come in through the wound into your heart system, into your valve, which causes an inflammation of your outer valve layer in your heart. So how long do oral piercings last? As long as your mouth stays free of infection and your oral piercings do not interfere with normal function, they can stay in your mouth indefinitely. So basically, guys, that's all I have for you this week on oral piercings, guys. As always, you do what you want to do you, boo. And just be careful about infections. Make sure your piercing dude knows what he's doing, or chick, or gal. Make sure they know what they're doing in your mouth. I would recommend you first go to your dentist. He can tell you about the risks, and he can tell you how to avoid the risks and all of that. So basically, the main thing is that infection, paralysis, blood-borne diseases, stuff like that. Just be careful. As always, just be clean with what you do. Make sure you clean your mouth regularly. Make sure the piercing is all good and all of that. So that was me, Carl Demadema, on the Oral Health Bar talking about oral piercings and the effect on your mouth. Next week's episode will be on oral manifestations of women. It's for the ladies next time, for the ladies. This has been the Oral Health Bar Talk. See you next time. Drop a like, subscribe. Just smile.